Good evening, everybody, and thanks so much for being with us tonight. My name is Daniel Staffenberg, and I'm the CEO of the Jewish Community Federation of Richmond. It's exciting to know that we have over 200 people registered to be with us this evening. There's a saying in Jewish life that man plans and God laughs. Well, that's definitely true today. We learned just a short time ago that Dr. Avula was being called by the governor to speak at the Capitol this evening. Don't fret. Over the last few months, we have learned to be resilient and adapt. And tonight, filling in very admirably for Dr. Avula, we have Dr. Stephen Richard, the medical director for the Richmond and Henrico Health Department, and Stephanie Toney, community health supervisor. We really appreciate you both being with us and for the information you'll share. Tonight's program is going to include some opening remarks from Dr. Richard and Stephanie, Dr. Richard and Stephanie, a personal account from our friend and RTA president, Dr. Tino Habib, who has received his first dose of the vaccine, and then a conversation based on the questions we received in the registration process. Before we begin, I would like to take a moment to remember the many lives that have been lost, impacted, and affected by this virus. The last 10 months have been a time of loss for so many locally and around the world. We pray that those all currently ill return to health quickly, and that the memory of those that we've lost provides comfort and blessing to their loved ones. Baruch Dayan Ha'emet. I also want to thank the so many doctors, nurses, health professionals, teachers, and first responders for their tireless work on the front lines. So let's get started. Let's bring on Dr. Richard and Stephanie, and we'll ask Dr. Richard to make some opening remarks for us.
Thank you, Daniel. So I'm Dr. Stephen Richard. I'm the medical director for Richmond City and Henrico Health Departments, as Daniel said. I'm a board certified family physician. During this COVID pandemic, my role has been physician outreach and communication liaison with community providers, as well as I've been very heavily involved in COVID testing of community-based COVID testing. And I want to just talk a moment about where we are with COVID right now, and then touch on the vaccine rollout. And I'll let Stephanie tie into any comments she wants to add, and then we'll open it up to questions. So, you know, since this pandemic started in the state of Virginia is what I'm going to focus on. We've had approximately 400, as of yesterday, it was when I last looked at the data, we've had approximately 404,000 cases with about 5,300 or 5,400 actually deaths attributed to COVID, a little bit more than 1%. Currently, we're seeing a spike in COVID following the holiday season with a positivity rate that is an average of how much, a 7-day running average of percent positivities of tests we're doing. Statewide, is about 16.5% to 17%. And just last week, it was about 15%. In Richmond City, it's bumped up to 15% from 12% last week. And in Henrico County, it has bumped up from approximately, Henrico County was 12% last week, 15% this week, and Richmond City has bumped from 11% to 12% in the past week. So these are concerning trends. They're snapshots, but the trend appears to be that we're seeing an uptick in infections in our communities, both statewide and locally. And I encourage everyone to continue being conscious of washing your hands, wearing a mask, and being conscious of social distancing. I really can't emphasize the importance that though we're starting to see the light at the end of the tunnel with vaccine, we've got a long way to go yet. So that's sort of where, in a nutshell of where we are with COVID, both statewide and regionally here. The vaccine rollout in Virginia, to be frank, has been quite bumpy. We started December 15th. Dr. Avula was, many of you probably know, our health director has recently been appointed to go ahead and take on the job of overseeing our vaccination efforts in the state because of the bumps we were hitting in the administration process of getting this vaccine rolled out. I think things are already starting to smooth, and we're going to be getting more and more vaccine out to the public and dispensed through pharmacies and to the general public. We're making a lot of progress. We've initiated vaccination with our healthcare providers, and we anticipate all our healthcare providers, which are in category 1A, to be vaccinated by the end of January. At the same time, we are rolling out the 1B group, and I'll let Stephanie go over the prioritization groups briefly in a moment. But we are following the CDC Advisory Committee of Immunization Practices on trying to allocate vaccine in an appropriate manner relative to risk of contracting COVID. And the people that bear the highest burden with COVID are being vaccinated ahead of others. We're trying to use good equity judgment with this, as well as people's medical background, medical situation and problems. So I'm sure you will have questions about that, but I think we are starting to see the light at the end of the tunnel. We need to hang in there and practice good hand hygiene, good mask wearing, and good social distancing, limit our groups, and we're going to get through this.
Stephanie, you want to follow up on the how the rollout is going to happen?
Yes. So right now we are focusing on healthcare workers and those that live in long-term care facilities in group that's phase 1A. We hope by February to begin rolling out to those that are in 1B, which would include those 75 years old and older, as well as essential workers. And so when Dr. Richard was mentioning, like, we're really trying to think through that, the CDC has shared with us, best practices on sharing. To an example would be the police, but specifically, or transit. Transit could mean a lot of different things depending on where you live, right? And so we're really trying to make sure that we do a good job with equity and integrity to distribute the vaccine accordingly.
Fantastic, thank you. Let's jump in. I think Tino is not quite on yet. Let's jump on to a couple of the key questions that I know we've been getting a ton of to start. One is, as we go through the rollout, what is the process going to be for the general public, or even some of those more, I'll call them more experienced, more senior members of our community that may not have overlying health concerns? What's the process for them to get in line for a vaccine, or most importantly, be notified that it's their turn?
Stephanie, you want to handle that?
Yeah, so we're going to be working with our community partners, as well as primary care doctors. There's a couple of different ways that you might hear about this information. It may be through email, it may be through social media when we get to that point where it really is open to the public. But as far as targeting specific age groups, it may be that we partner with local pharmacies. Local pharmacies will be helping us with the distribution. Right now, they're helping with long-term care and assisted living. We're gonna, we know properties that identify as a specific age range in order to meet a requirement to live there. So we may be working with property managers to be able to facilitate disseminating that information. So we have several tactics that we're going to be using. Largely, it's probably going to be word of mouth, right? Like, anything, that's usually what spreads the fastest, especially with the population that we're targeting. They may not be on social media. They may not be checking their email and certain other platforms. So looking for the Jewish Community Federation to be helping us to disseminate that information as well.
Okay. And I guess the follow-up question is there any proactive thing that somebody could be doing? Is there a, is it contacting their primary care physician, primary care provider, or is it kind of just have to wait for, hey, it's your turn?
Right. So we do have a document that's going to be going live in starting tomorrow. We're going to provide a press release, and we'll have a document on our website that you can complete an interest form, and that will be able to help us disseminate the information accordingly. So it'll ask how many, the form is written more for organizations than for person specific, but you could complete it on behalf of yourself as well. And then you'll get a reply email within a couple of days that says, we're not ready to disseminate to the phase that you may qualify for at this time, but we have your information, and we'll, creating listservs and be able to share that information when the time comes.
Okay. And I know the goal is 25,000 immunizations a day, I believe. Do you have a timeline? Are we expecting March, April for general population, or is it more into the summer?
I would guesstimate that we're thinking more into the summer. So if we look at 1B, so there's several phases, like I mentioned. We've got 1A, 1B, 1C. And so we're looking at sharing that information based on the organization in which you work at and the role in which you work in. And so for the general public, I probably would say later this spring to early summer would be an aim of ours, but sooner rather than later is where we're trying to go with everything that we do.
Okay. And just, Stephanie, I'm going to transition to some of the efficacy and safety of the vaccine, but what is the website? It's the Virginia Department of Health website or Henrico Department of Health?
So you can go to vax.rchd.com, and it will redirect you to our interest forms. That will be live tomorrow. So right now it's only live for those that believe that they are in the category or phase 1A. And so for 1B, that would go live tomorrow.
Just because I'm not as good a typer as I'd like to be, vax.rchd.com.
You got it. Yep.
Okay, I have put it in the chat.
That's
Fantastic.
correct.
Can you guys talk a little bit about, we had some questions around, clearly this was a Herculean effort across the world really to make this vaccine come to fruition. Safety, were there any shortcuts made, et cetera, as well as there was some, I think some questioning about how effective is it going to be going forward as well. I don't know if that's a Dr. Richard or a Stephanie question.
I'm happy to try to answer that to the best of my ability. Let me first say that I am a board certified family physician. I'm not an immunologist or a virologist. I'm sure that our audience may have some physicians that may be more knowledgeable than myself on virology and immunization practices. I have been attending a lot of CDC webinars and doing a lot of extensive reading and communication with community providers. So I feel like I'm pretty much in tune with the knowledge base on especially the messenger RNA vaccines. So in development right now, in process to in the United States, there are 6 vaccines, 2 of which have received emergency use authorization. Both of those are messenger RNA vaccines. The Pfizer-BioNTech, which was a joint venture by 2 different companies, Pfizer and BioNTech, they were the first out, and then there was shortly thereafter, Moderna came out. These are both messenger RNA vaccines. Well, what is messenger RNA? Messenger RNA is a protein that cells utilize to messenger protein synthesis from the cells. And I'm going to try to give you a little basic biology here. and drop back 20 years to basic science when the Mediterranean Eastern Respiratory Syndrome and the SARS syndrome of the early 2000s came out. These are related to the coronavirus, and a lot of basic science research has been going on for about 20 years regarding this virus. So a lot of the groundwork and knowledge base was already laid before we were hit with this virus. Once the virus's genotype was identified, when its genome was clearly delineated in January and released, the scientists of Pfizer, BioNTech, and Moderna were able to pretty quickly make this messenger RNA from that genotype. And that's why this production has come on so fast. Older traditional vaccines take a lot more, the methodology is different. But let me say with this vaccine, it was also scaled up with an enormous federal investment. Lots of money was laid down to back the process, and the companies that entered the trials and went into this, some 240 different vaccines started out, and we're down to about 6 that are coming through U.S. trials. So there's been a very intensive vetting process of the vaccines that have been in the pipeline. And I'm going to focus on the 2 vaccines that we have, the messenger RNA vaccines, and not try to get ahead of ourselves since the others are not out on the market yet. The trials were pretty large scale trials, of about 44,000 patients. That is a good working number. Of course, once you expand it to millions, you'll gain more knowledge, and I'll talk about that a little bit down the road. But that's a good working number to identify what the efficacy and the likelihood of long-term antibody sustainability is, even though it seems like a short period of time. With those large numbers, we've been able to delineate a lot of information. I'm going to try to make this as clear as possible. I don't know how many people in the audience have biology degrees, but when this messenger RNA is coated with a lipid, with a fat type particles, that so this protein that's going to program the ribosome factories in the cells, is coated with this lipid that protects it. Now, the Pfizer vaccine requires a super cold storage to protect that protein from breaking down and that lipid layer. And that's part of the rollout problems with that super cold storage, but they've overcome all those barriers, and the freezers are now coming online at the different pharmacies and hospital entities. Daniel, I don't want to get too protracted. I'm gonna try to speed it up here. But
you're good.
Moderna is a little bit more user-friendly, doesn't require quite as severe cold temperatures, and has a little bit more shelf stability. But in principle, both these vaccines are very similar. So when the vaccine gets thawed to room temperature and then injected in your arm, it goes into the cells in your arm in the cytoplasm, not into the nucleus. It turns on the protein production of a protein that is a spike protein that sits on the coronavirus. And that is so it makes your cells produce this spike protein. You aren't getting injected with live virus or anything that manipulates your cell's DNA. It simply programs your protein factory in the cell for about 10 days to produce this spike protein. And then this messenger RNA just sort of over time wears out and breaks down on its own and dissipates. So for about 10 days, your own cells become a antigen factory. It's producing this S spike protein that circulates in your blood and produces an immune response where your immune system recognizes this foreign protein and generates this immunity. And after about 2 weeks, just with one shot of these vaccines, 50 to 70% of people are showing pretty good immunity. 2 shots are needed really to bring you up to about 95% of people demonstrating good immunity. So I'm not a virologist, I'm not an immunologist, but from all the reading I've done on this and the webinars I've attended, this vaccine really looks very clean. It's yes, there are people that have allergic reactions to any product. That's a price we're going to pay with any vaccination. There are going to be outliers, but overall, this is a pretty clean vaccine and appears very safe.
And just, first of all, I feel like I just went through a biology class, so thank you. Bring me back to some high school, which is good. The science is sound, and 95% sounds pretty good. Just as a quick reminder, the flu vaccine is what percent effective?
Anywhere from 30 to 50%, and sometimes
So that's
lower, depending on the vaccine. I mean, it's very variable.
So one of the other questions that we're seeing, and I am following them on, trying to keep up, is we've seen in Israel, where many of us are focused, that at the end of the scheduled line of the 75 and over and those at risk, if there is vaccine left over, you can stand in line and get the vaccine so that no vaccine goes to waste. Is that something that's being considered here, or we're not there yet?
That happens on an extremely small scale because with the registration portals, the way they're set up, people are scheduled to come in and they can allocate the vaccine and not thaw out any more than they need. The healthcare workers or first line workers, I think we've had a couple of people that we vaccinated because we had one extra dose of vaccine at the end of a 500 vaccination clinic, but we don't have enough to even begin to offer a standby setup to do that right now. And we're still in the process. Vaccine is coming on board and we're getting more and more vaccine shipped in, but we don't have enough supply yet to get there with that sort of scenario.
I guess today, Alex Azar, in DC, announced kind of a goal of expanding the vaccinations. It sounds like that has been taken into account when you guys are doing our local vaccinations, but that it's still a little bit of a supply challenge. Am I reading that correct?
That's my interpretation, and I'm waiting for the dust to completely settle on that. Stephanie, do you have any thoughts about that?
No, I would concur. Where, on Friday, they released us to begin to plan ahead for phase 1B. We're making sure that we're in due diligence and have shared the opportunity with all of 1A in our area. And so, yes, I would say that while we have a good allotment assigned to Virginia, Richmond, and Henrico in our local area, it could still be a challenge with actually having enough vaccine. But we are making sure that while we just back to the statement of if we have an extra dose or two, we're still making sure that that is given to someone within the appropriate phase. So we wouldn't just call up my mom to say, hey, we got an extra dose, can you come on down, right? We're making sure that it still adheres to the phase that we're in.
Okay. And Dr. Richard, you mentioned it's been a little bumpy going on, and we understand our friend, Dr. Avula, has been elevated to kind of lead this for the state. Are you expecting or planning, is there kind of a time frame when maybe the bumps will begin to smooth, as we see now on TV, some of our friends in other states or other ways getting the vaccine? I know there's some energy around getting out of this.
I wish I could give you a distinct timeline, and it's a shot, excuse the pun, a shot in the dark. I'm cautiously optimistic that we're going to see things under Dr. Avula's leadership start smoothing in a short while, and it'll become apparent to the public that we're making a better rollout than we had. But I don't want to make promises I can't keep. I'm hopeful that we will see less troubled waters by the end of this month.
Well, you get to make promises that Dr. Avula now gets to keep. So him not
Right.
being here, we get to.
There you go. There you go.
Some other, maybe some quick questions that are going through, and then I want to bring on our friend from JFS Richmond, Wendy Kruder, who I think got a little different question. Is there any idea of how long the vaccine will last? And is this
Well,
going to be an annual shot that we will need?
the webinars I have attended suggest 2 to 3 years. It's going to be more than one. It's not going to be an annual shot. We're cautiously
Even
optimistic
with this
that,
new strain or whatever we're hearing.
it is equally effective against, to date, it is equally effective from everything I've read to these new variants that are more infectious. It hasn't changed its susceptibility to generating an immune response to those variants.
The other question I'm seeing is, if you get the first shot, you are guaranteed to get the second shot, correct? That's part of the timing challenge that we're having. That
correct. The current recommendations is to stay within that. I read an article this weekend from the Biden administration talking about rolling out more that might plane that and change that dynamic. And I have to wait and see what gets rolled out from the top down on that. The argument there, the British are vaccinating and extending the period of the follow-up vaccine. I tend to favor staying with the science and staying with what the studies show the best immune response. I think it's a gamble, but we are waiting to get the guidance that it will be forthcoming on that.
But it would be a national change that we would have to adhere
Right.
to.
Yes, it would be a national.
Locally, we made a decision to not give the second dose. It would be a national order that we have to abide by.
Thank you, Stephanie. That's correct.
Thank you. It's my pleasure to bring in my friend and one of our amazing colleagues. We're blessed with so many here in Richmond, Wendy Kruder, who is the CEO of JFS Richmond. Wendy, you
Hi,
have
Daniel. Thank you. Thank you, Dr. Richard. And hi, Stephanie. Thank you, too. I have a question for you. At JFS, we fit in, I think, your first category of folks, essential workers in 1A. And as I think we've heard maybe a little bit, there are individuals that are hesitant to get the vaccine. Is there anything that you can recommend that is something that they would trust, that you're sending or giving to folks to try to help them understand a little more about the vaccine and feel a little bit better about getting it?
Thanks, Wendy.
I'm hoping
Yeah.
our talk, my response is I'm hoping our talking about this here is one mechanism of trying to allay those fears. I will reiterate that I think this is an extremely clean vaccine, and to me, the only reason to have any pause about getting the vaccine is if you have a known anaphylactic reaction to a prior injection, then you need careful review of what is in that injectable product compared to what's in either the Pfizer BioNTech or the Moderna product that you're receiving, because there's always a possibility, and that needs to be very, very much scrutinized. But and whatever media we can put out to make people accept that it's a safe product, we will do. And Stephanie, do you have any thoughts along those lines?
Yeah, so I was going to add maybe seeing someone that they trust getting the vaccine. So if you know of someone that is agreeable to getting their picture taken, or video of them getting the vaccine, or being able to speak to how did you feel after you received it, when you get your second dose, those type of feedback, I think it would be really helpful to reassure the sphere of influence that they have around others.
That's great. We can try to do that. Thank you.
We can definitely do that. Thank you, Wendy. Yeah. Thanks for all you're doing to help our community. Thank you. You guys don't get away so easy here.
Excuse me.
For those people that are asking questions or have your hands up, if you could type your question in the chat box or in the question and answer screen, we'll do our best to get through all of them here, or as many as we can. If you miss, so if down the road I'm eligible to get the vaccine, but I miss that opportunity, or I'm away or whatever, I can just pop back in line at the next available time. How does that work, Stephanie?
Yeah, that's a great question. So let's say you're not ready now, but in 2 months from now, you're ready and we're on phase 1A now. Someone from JFS is not ready right now, but they'll be ready next month. We've already moved on to phase 1B. You're still eligible at any time when you're ready to get the vaccine. So we encourage you, when we send you the invitation through your employer, usually, well, at this phase where we're talking about organizations, we send an email through your employer to say that you are eligible to receive the vaccine. You're going to register on a website called VAMS, which stands for Vaccine Administration Management System, VAMS, and you'll create a account in that portal, and you will schedule an appointment for when you want to get the vaccine done. So once you register, you'll see the appointment slots that are available in your area, the dates, and then you will be able to schedule an appointment at that time. So if that's 3 months from now, you'll still be able to do that. So we invite you to go ahead and create an account, and then when you're ready, go back in and actually schedule your appointment.
And that website is vams.com?
No, I think it's more complicated than that. I believe it's vams.cdc.gov, if I'm not mistaken, but I don't have that information pulled up in front of me. But when you receive the email, it will have the specific instructions about where to go to actually register. It's by invitation only at this point. So it wouldn't be you just go to that website and you can create an account. You'd have to have a specific link in order to create your account.
Gotcha.
Because
You can't just
you're
go.
in there.
Okay.
Correct.
The other questions that we're seeing are, and Dr. Rashad, thank you for being so forthcoming. Right now, we have a supply issue, it sounds like. We got plenty of arms to put the vaccine in, and lots of people willing to, but we have a supply issue. What is the holdup at this point? And what is the holdup at this point for getting more vaccine?
It's a combination of both supply and organizing the distribution of it. I don't know that, it's a combination of the two. And part of that is why Dr. Avula is taking over the role, or is assigned the role he's been assigned, to hopefully smooth out those bumps that I allude to.
Okay.
It's the best answer I can give. Stephanie, do you have any response to that?
So I'd add, just the complexity of what does this bullet point mean, right? So when we talk about frontline workers in 1B, we have, 8 bullet points that say fire, hazmat, corrections, daycare, childcare, food and agriculture, manufacturing. And then the example I gave at the beginning of our discussion was public transit workers. That can mean a lot of different things, right? And so we're at the stage where we're really trying to make sure that as we are distributing it in an equitable way, that we do a good job of disseminating the information as to what this means for our area based on the organizations that we have, and not leaving anyone out.
Okay. And those 2 websites that you've mentioned seem to be the key point that people should take away for ongoing information as well. Cool. Are there more vaccines? We've heard about an AstraZeneca vaccine. We've heard about some of these others. I think even Dr. Richard, you said there were some others that were coming online. Do we know any ETA on those?
The AstraZeneca has been opened up and approved in the United Kingdom, and is being rolled out, I think, in the next month or so in Europe. It probably, from what I've read, is not going to come out in the United States until mid to late spring. And there's a Johnson & Johnson vaccine. I can't recall the name of that, and 2 others that are in the pipeline. total of 4 additional in the pipeline, but I do not anticipate those coming, getting authorization and dispensing to public until April at the earliest.
Okay. Stephanie, there's a question about, we've been talking a lot about this coming through employers, and I know you and I had a very brief conversation earlier about the potential for mass vaccination events, or the Federation or the community partnering with you to make those available. Many of our over 65 don't have an employer. They have the joy of being retired. How do they stay in the loop, especially if they have medical conditions that may put them closer in the line?
I probably would refer them back to their primary care doctor, as well as local pharmacies if they are, getting any prescriptions filled at local pharmacies. We'll be working closely with local pharmacies to help disseminate the vaccine. Right now, pharmacies are helping us with long-term care facilities, as well as independent living care. So we're working closely with pharmacies and primary care doctors.
And so it sounds like, if I'm extrapolating from that, the doctors will be able to help prioritize some of the people that they think might need it, cancer survivors, others with immunosuppressed or others. Am I reading that correctly, or am I making a leap that's not fair?
Right. So like the pharmacy would be able to say, we have, 1,000 clients that are above the age of 75. And so we have their phone number, we have their address, so we can share with them that at this point we're opening up to phase 1B, and they're eligible to get the vaccine. We can offer it here, or we can plan to allocate for them to receive it, whether they choose to get it or not. We can make sure that we work with them in order to register to receive it, and then they can come here when they're picking up their prescriptions to receive the vaccine.
And Stephanie, is that, do you believe that the CVS's, the Walgreens, they're ready, or have that process in place already?
I believe so. We've been talking about this. Like, all roads have been leading to getting a vaccine. And so everyone has been thinking about when this happens. It hasn't been if this is going to happen. The conversation, I feel like, has always been when we get a vaccine. And so we've always been planning for this. And so we do have a wonderful Medical Reserve Corps, or MRC, volunteers that we can mobilize as well. So when we think about manpower, and when you're just walking into the pharmacy, they may not answer the phone as quickly as you'd like, because they, it seems as if they're understaffed. But when we talk about this, we'll be able to activate another level of workforce to be able to disseminate or administer the vaccine.
Okay, great. I'm just checking questions. Steve and Stephanie, thank you so much for taking the time. We really appreciate it. You talked about 95% safe, Steve, Dr. Richard. Is that after the second dose? And does that still mean that you could be a transmitter of the virus, or harm somebody else?
Very good question. So it's not, when I say 95% efficacy, it means after the second dose, 95 out of 100 individuals have adequate antibody to prevent themselves from getting sick from coronavirus. The preliminary information suggests that the vaccine reduces transmission in 30 to 50% of those vaccinated, but not 100%. So we're back to the wearing the mask, social distancing, and good hand washing until we reach a adequate, quote, herd immunity, which is probably throughout 2021, isn't going to happen in this calendar year. Okay. We're going to have to keep our nose to the grindstone and really continue to practice good, healthy hygiene and behaviors, avoidance of heavy crowds, if we're going to get to a true immunity through our vaccination approach. So the data may show down the road that there is reduction in transmission, and we can be more reassured by that. But right now we can't go down that. I don't have any science to strongly support that.
Okay.
And then to the part of the question about it is possible, or we don't know the answer to the question of, can you still transmit it, right?
Yes,
So
yes.
you've vaccinated against it, your immune system knows what to do when it sees this spike protein, great. But could you still be a carrier and be shedding the virus? That's what we don't know. And that's why we're strongly encouraging the expectation of the gloves, the mask, washing hands, as well as social distancing.
Okay, great. Thank you. Will there be any need for in the 1A or 1B or as we roll out, as you said, into late spring, early summer for the general population, which I believe is the 1C population? Will there be any need of proof of medical condition to move up on that list? Do you have to bring a note from the doctor or some sort of something?
No, I mean, the prioritization groups already sort of sort that out. If you're the 1Cs are those with advanced medical conditions under 65 that need to be vaccinated. And my response to that is I don't anticipate anybody's going to need to show certain, you know, verification that they fall into any one group. We're hoping people have enough integrity to live within the guidelines and that have been stipulated. And the providers providing the vaccine have a due diligence to try to have integrity and making sure the system is not being abused and people are being appropriately vaccinated at the right time.
Okay, great. So and I will reiterate this, masks are not going away anytime soon, even after we've had significant vaccinations throughout the community. And stock up on your sanitizer now, it sounds like, as well.
Correct.
We've had a little bit of questions for those with young families. We've heard and we've seen that children or younger children are not nearly as affected by the virus. I know Henrico is about to go back to school in person for some. Can you speak just a little bit about that decision and how the effect might be different if it is on younger children?
Well, let's talk about vaccination first. The studies were eight, I believe in the Pfizer study was 16 and up, and the Moderna study was 18 and up. So all the guidance is that we're not vaccinating with people who do not meet those criteria because they haven't been approved in the emergency authorization. There are studies now going on in the 12 to 17 age group to make sure it's safe in that population. And as that population gets added to the vaccine rosters, so to speak, and approved, they will back it down. They'll be doing concurrent studies on the from 5 to 12 and even younger than 5, and just making a decision on those groups. But it's being done in an incremental fashion and with safety first and foremost. So at some point, children will be part of the vaccination strategy. Let me emphasize that. It's just we're not there yet. We're doing the adult population first. Secondly, to your question, that there's no question that COVID dramatically affects people with small children. I mean, small children and children can be transmitters of the virus, and we need to be conscious of that. They can have very deleterious effects from the virus. It's rare, but it does happen. It's, I think it's hard to get adults to follow the social distancing, hand washing, and wearing of a mask, and it's even harder to do it with kids. So I've rambled a little bit here. I don't know if I've gotten off topic and answer your question, or whether Stephanie wants to dovetail on that at all.
I think you answered well.
Okay.
It's kind of a conversation, so a little bit of rambling is okay. This has been value of information. I know we have a stop at 6:30, so I just want to try and run through a couple more quick questions here. You talked about the cold and the need to keep the Pfizer vaccine very, very cold. There was a question about could it be compromised in transport. It's talk about that.
Well, they have a pretty impressive technology from everything I've read in tracking every container containing the vaccine, making sure that it is maintained at the same temperature. It has alarm systems that goes off and is transmitted. I'm pretty confident that the the people that came out with this product made sure that they're going to ensure that it gets to the arm in a good condition. Stephanie, do you want to go into any more detail about that?
I was just going to add that while the local health departments have Moderna, the health systems usually have Pfizer because they can handle that cold, I think it's called a cold chain, as far as not breaking the chain, as far as the temperature in which it needs to stay at to be stable. Right. And so, yeah, as we get more, the right freezer, ultra cold freezers to be able to handle it, that may change in the future. But at this point, that's what you'll see for the most part. And then whatever vaccine you start with, you should end with. So if you get the Moderna vaccine first dose, you need to make sure that you get Moderna as the second dose as well. They're not interchangeable to say that you can get one dose of one type and another of another type. But when you get the vaccine, they'll be very clear with you what you've gotten, let you know when you're eligible to get the second dose, because the time frame for Pfizer is 21 days from your first dose, you should get your second dose, and 28 days for Moderna that you get your second dose. So they'll be very clear when you get your
Moderna. It's 3 weeks. The Pfizer's 2 weeks.
No, Pfizer's 3 and Moderna is 4. Moderna is 4 weeks.
I apologize. My math was off.
But I want to take a moment to talk about V-Safe. I don't know if anybody, the vaccine, when the CDC set up this vaccination effort, it created a whole new mechanism to track safety, since these are new vaccines, and maybe to allay people's fears regarding the vaccine it is new to the block, so to speak, and you need to watch it and make sure there is not some unexpected turn of events that wasn't anticipated. History is replete with that happening. So the V-Safe system is when you get your vaccine, hopefully you have a smartphone. Most people have a smartphone now. There's a barcode you scan while you're waiting you're in your waiting area, and most people have to wait for at least 15 minutes. If you have a history of allergies, we observe you for 30 minutes. I should say allergies to medications. We observe you for a full 30 minutes, or allergies really across the board. We watch you for 30 minutes. But during that time frame, you scan your smartphone to a barcode, and it takes you to a URL, and you register. You just put your name and phone number in with the CDC, and that will automatically trigger follow-up text messages to you periodically, checking on how you're doing, whether you're having any symptoms, whether you're having any problems. And that's going to stretch out to a monthly check-in, then a once every 3-month check-in, actually for a full calendar year, to try to identify any outlying problems that were not foreseen. And it's a rather novel system that I've been using since I got my first dose of Moderna, and I got a check-in today that very quick, just check, you just go through a little checklist in a text message and send it off, and you're done. So there are a number of monitoring systems for vaccines, but this is a new and additional modality that is rolled out for this to try to ensure that these products are safe going forward.
Fantastic. Thank you. Some questions about, for those that are allergic to certain medications, they should talk this through with their primary care provider and determine what materials might be in the vaccine. How should
correct? There's a published list in the product insert on the of the Moderna and the Pfizer BioNTech of all the different substrates that are in the vaccine, in the solution. The biggest is polyethylene glycol, which which is a stabilizer in the vaccine solution. And some people can have a cross-reactivity to the polysubstrate. I'm sorry, it's called a polysubstrate. It's not polyethylene glycol, but you see polyethylene glycol in some vaccine, other type of injectable medications that stabilize that product. So if you have a history of anaphylaxis, that is severe allergy, life-threatening reaction to an injectable product, it is recommended that a provider actually cross-reference everything that's in in the injectable product that caused that reaction with the product handout that's with Moderna or Pfizer, whichever you're getting, and make sure there does not appear to be a cross-reactive problem. Everyone administering this vaccine is carrying medical response equipment and medicinals to respond to an allergic reaction.
So that is something that people could be doing almost now, is doing a little pre-preparation to make sure if they're available or not. Unfortunately, more and more people in the community are getting COVID. Do those people also still need to get the vaccine?
Interesting and good question. If you've had a documented COVID infection, you shouldn't get vaccinated for up to 3 months. The literature says and shows that you have auto protection from your infection for up to 3 months. After 3 months, it's unclear whether you have continued immunity to future infections. There have been a couple of documented cases where people actually got a second case of COVID. So the CDC's recommendation is you wait the 90 days from when you were diagnosed with an active infection, and then you become a vaccine candidate at that time.
Okay. I want to thank you both very, very much. We will reach out and likely do this again in the next couple months, and we are deeply appreciative of both of your time today. If people didn't get their question answered, we will try and find some time to do this again, and they can reach out. Maybe Stephanie, if you can help me just with those 2 websites again. I'll try and put them back in the chat. What were the 2 key websites that you had talked about?
Sure. So I probably would say if you have an interest form, if you want to complete an interest form, that would be vax.rchd.com. And that is a shortened website, of course, and it will reroute you to the longer link in order to complete an interest form. And then even on our website there are a lot of there's additional information about distribution, getting additional information. If you want more information for a group that you may be having and, want to host your own town hall or info session. So you can find all of that on the website, rchd.com.
Okay, fantastic. And then we talked about one other one for general information about when we can get the vaccine or what the rollout is. I'm sorry, I'm forgetting it. I was listening so intently. Should we just go visit the Henrico and Richmond or VDH website itself?
So you can do VDH website if you'd like. There's information about distribution and what phase that we're in as well on that website. And I want to say it's vdh.virginia.gov.
Okay, fantastic.
Mm-hmm.
Thank you very much. And I want to say to each of you and to Dr. Avula in absence, we have deeply appreciated the partnership with the Henrico Health Department and the Richmond Health Department, and it has been valuable throughout this 10 months. Who would have thought it would have taken 10 months, but it's been invaluable. Dr. Richard, good continued luck, and thank you for your time. Everyone else, have a wonderful evening. Thank you so much for joining us tonight.
Thank you. You guys have a wonderful night as well.
Have a good one.
Bye-bye.